Over recent weeks, the nation has quite rightly been celebrating the National Health Service 70th birthday with much fanfare. I'm in no doubt that we all share in that joy that such a treasured institution has stood the test of time so far. Another birthday celebration that has slipped under the radar in comparison is the 130th birthday of local government. I wonder if the NHS would have reached such a grand old age were it not for the existence and support of local government. I was intrigued last week, Mr. Chairman, to see a news report on a doctor who was there at the birth of the NHS to say it was created in the belief that by making people fitter and healthier, there would be a reduction in the long-term costs to the country. But he also went on to say that if anything, it's been a victim of its own success. I would agree with that. And the impact of an ageing population now means that social care costs are spiralling out of control. Mr. Chairman, I believe he was right. And I suspect most of us in this chamber would also agree with him. And that's where local government comes in, because both public health and social care service are fundamental to the success of the National Health Service now and in the future. We cannot keep talking about the National Health Service hospitals as being the only thing that matters. It is my challenge to government and parliament to talk about the NHS and local government in the same breath. Well, I'm delighted the Prime Minister has reaffirmed her government's unwavering support for the National Health Service with a pledge of an extra £20 billion in future funding. We should be in no doubt that this will not solve all the health service problems. Funding simply cannot be poured just into hospitals, when too little consideration is being given to the other vital elements of healthcare, namely prevention and social care. The government needs to decide how it is going to fund our social care system and public health prevention services, and not just the acute aspects within the NHS. But the government seems reluctant to take the necessary action to invest adequately in these two vital elements of our nation's health and well-being. This risks leaving councils up and down the country, as well as the voluntary, the community and the faith sectors, who all perform vital roles, powerless to ease the pressure on the National Health Service. And without that help, there may be no birthday cake in 70 years' time. In fact, Mr. Chairman, I doubt there will be a birthday cake in 10 years' time. My real concern is that government and parliament will have missed the opportunity that is staring them in the face by providing the necessary support and funding for prevention services and social care that the public needs. Local government has made a lasting difference to generation after generation, tackling poverty, building social housing, introducing universal education, and of course, delivering public health and social care services. Indeed, some of its achievements even predate the Local Government Act of 1888. Among these magnificent achievements are the health benefits resulting from the Joseph Chamberlain's reform to housing and the water system in Birmingham. They show that it would be wrong to assume that local government is a newcomer to the health agenda. And if we are to save Britain's healthcare system, and we must, then local government needs fair and equal resources to improve both public health and social care in our country. There needs to be public scrutiny of the entire healthcare system. And today, there is still no democratic governance oversight of the local doctors or the community health service in the front line. I call upon government to empower local government to become the public scrutiny body for these vital frontline services. The people need us and need local government to help to make sure that the services are right. I also call on government to give councils responsibility for commissioning all public services that deliver health and well-being services in our communities. I would urge ministers to allow those councils who are willing to be given the opportunity to pilot this approach. It is in our intention to present joint health and social care commissioning plans to the Secretary of State for Health, Mr. Hunt. Sorry, I forgot, he's just gone. To Mr. Hancock. Anybody got a check on that lately? In September, for our approval, the Chief Executive and I had a meeting with Mr. Hunt on last Tuesday, and we were clear that he was clear we were going to bring a pilot commissioning project forward. And I hope I shall be writing to Mr. Hancock to remind him that that's what we had discussed. It's important that we are, local governments, at the vanguard of change for our residents. And as a first step, I firmly believe there should be 24 access to doctors during evenings and weekends to release the strain on the accident and emergency departments. Resources being made available to schools and other organisations to help to identify mental health issues and signpost those with need to the appropriate early area for early intervention. I think people wait far too long. When local government was handed back responsibility for public health several years ago, I regret funding was promptly cut, but responsibilities remained. We can't continue with huge disparities across the country. Indeed, the public health grant for local authorities has fallen by 17% over the past 5 years. And as you know, Mr. Chairman, Surrey is one of the authorities that's been hit hardest. While funding the heart of the health service may win positive news headlines for government MPs, failing to resource many of the other key services that are accessed by large numbers of our population risk worse headlines in the future. Mr. Chairman, many of my local government leader colleagues believe that the government is taking far too long to produce its green paper on adult social care. There is also genuine concern that the paper will simply follow the same format as one of the dozens of other papers that are its predecessors of the past 2 decades. A little more than warm words with no action and no long-term solution. Not good enough. How can this possibly be good for the health of our nation? Surely the Green Paper needs to be coterminous with the NHS 10-year plan, as they depend on each other, and the people who deliver the service on the ground must be invited to contribute. I strongly believe that local government needs much greater input into the Green Paper. Social care services won't be delivered by MPs or Whitehall officials. They'll be delivered by local government in our communities with the many dedicated staff we have. Over the last 10 years, we've all seen huge transformations in local government services, despite the significant financial challenges. So there's a great deal the NHS can benefit from working with local government to respond to the changing circumstances of local people. We know and understand the needs of our communities and are best placed to deliver the foundations of good health and well-being. And in order for health and social care to work more effectively and efficiently together, I suggest the government needs to do the following. Ensure equalisation of public health funding across England. Enhance funding for local GP and community services, enabling better access when people need it, to stop them turning up at A&E. We need to design a stronger governance model, enabling local government to be more accountable for setting priorities and joint commissioning. These actions will then reduce the numbers needing unplanned hospital care. Our long-term vision should be a public health system that leads to real sustained changing opportunities for all. Well-funded local GP and community services that become more effective and more accountable to local people through local government. Fewer people going into hospital when they don't need to. Ensure the country has enough doctors, nurses, and social care workers to increase the effectiveness of the health service system in this country. And appropriately resourced local social care services to ensure residents can return to their homes as soon as possible. Mr. Chairman, we often hear about a chronic bed shortage at hospitals. It's our job to get as many people sleeping in their own bed as quickly as we possibly can. That is what the guiding hand of local government can achieve. When all the components of health and social care systems are working smoothly together, there will be a less call on hospital services. Not only will this improve the quality of life for our residents, but also we will have created a system that is both sustainable and financially affordable for the next generation and beyond. The challenge now for government and Parliament is to let local government do what it does best and come to the aid of the NHS so that both the NHS and local government can celebrate birthday after birthday. To summarise, Mr. Chairman and members, I believe we all want an efficient and an effective health and social care system for everyone in this country. I believe we need investment in public health programmes to reduce the demand on health services down the line. We need excellent local GP services with more evening and weekend services. We need proper governance and accountability over local health services. We need to reduce the number of patients arriving and entering hospitals for unplanned care, especially at weekends. And finally, we need a local solution for social care services to ensure that all patients can be supported to return home and then enable them to live independently in their communities. Finally, and above all, Mr. Chairman and members, we need a health service that works closely with local government to do more to prevent chronic illness and to create a joined-up system that recognises and addresses the health needs as soon as possible. After all, Mr. Chairman, it is the public that fund these services, and I suggest we have a right to expect everyone in central government, the National Health Service and local government to work together for the health of the nation. Thank you.